Hey guys, I'm not gonna actually make these too long because, yeah, I'm having sync issues again with my webcam, but I've gotten a lot of video requests, so I thought I'd start answering some of them. Sorry about the dogs in the background. All the consequences of noise pollution, because I'm always outside when I make videos. Okay, these questions are from, let's see. Perhaps you could do a video on your opinion on EDs and psychiatric medication. Okay. Psych meds are a personal decision. I do think that they can be immensely helpful in eating disorders. The right agent and the dosing are very important for efficacy. Probably the two biggest concerns with these medications are, one, are they going to make me fat? And two, are they going to take my AD away from me? Because even though there may be a significant part of us that wants to be well, there's the toxic side that's always worrying with that and saying, no, you need to stay in control, you need to hold on to me and whatever. So it takes a strong commitment to be able to decide that you want to optimize your wellness and go ahead with these medications. Some people have good experience, some people have bad. I guess my best advice here, or I guess my overall opinion is, with the right dose and the right drug, they can be wonderful. I do not think that medications alone are sufficient, but they definitely help. Another common misconception is it's going to change who I am. Well, no, actually what it's going to do is correct your brain chemistry. This is not going to program you into someone else. So I like to think of, especially like antidepressants, as a safety net. Like, you're still going to trip and fall, but you won't fall as far, so it's easier to climb back out. I've been on antidepressants for years, and they definitely help. It's important, though, to always monitor your symptoms and see how you're doing. Like, if you feel a particular therapy isn't helping you anymore, that's possible. Some people get tolerant to certain drugs, or they stop helping as much. So sometimes rotating different drugs in the same family can help. And also, if you have a history of trying different medications, don't give up, because there's new agents coming out all the time with different mechanisms of action, lower side effect profiles. I really do think that these are an excellent tool in recovery, especially in bulimia nervosa. A lot of studies have been done that show that fluoxetine, Prozac in the U.S., is extremely effective in reducing the compulsive side of the ED. And in that case, the doses need to be a minimum of 60 milligrams. 80 is ideal. But again, you'll have to talk to your therapist about that, or your psychiatrist or doctor, whoever's prescribing your meds for you. If there's a particular drug you'd like me to discuss, let me know. But in general, I think they can be very helpful. And if you're afraid of weight gain, there are drugs that don't cause this. And also, interestingly, keep in mind that, especially in anorexia nervosa, a lot of appetite-promoting drugs have been prescribed in order to try and increase the patient's appetite. But they've been ineffective, because it's not that we don't have an appetite. It's that we don't act on satiating our hunger. So increasing one's hunger is not going to cure the anorexia. But it will help cope with, like, labile moods and stuff. And that's par for the course. Like, when you have an eating disorder, most of us have comorbid psychiatric conditions like depression or OCD or anxiety. Depression, anxiety is the most common. And so certain medications, psychotropic medications, can be very helpful for us to minimize the distress, severity, intensity, and frequency of bad feelings. I think of medications as another tool in your toolbox for getting well. It's not the end all be all solution, but it's definitely valuable. And if you're afraid of weight gain, really just keep in mind that the most appetiting? I'm inventing words. The most appetite stimulating drugs have been tried in anorexia treatment and do not cause the patient to gain weight because it's not about our hunger. So, in summary, I think they can be really helpful. I probably said that 6 million times. But yeah, if you have any other questions, please ask. This question was asked by Hot Chocolate Sundae. She actually asked me a whole bunch of stuff. But I'm just going to do short ones, and I might string them together. We'll see. Because I'm worried about my sync. So I'll be back for another one. Much love, guys. Be well, precious ones. Bye.